Here we've got two anterior and posterior views from a radionuclide bone scan. The most striking abnormality is this increased tracer uptake in the L3 vertebra, and to a lesser degree in L2. The rest of the axial skeleton looks normal, which suggests we're not dealing with widespread systemic disease here. Given the focus of uptake at L2 and L3, my immediate thoughts go to conditions that primarily affect the spine. In a case like this, I would consider metastatic disease if there's a known primary malignancy. However, if the patient presents with back pain and perhaps pyrexia of unknown origin, decitis jumps to the top of my differential, especially in elderly patients. The fact that this uptake is confined to two adjacent vertebrae makes decitis quite likely because it typically affects contiguous vertebrae and involves the disc space. Now, the findings could also be due to degenerative disease, but that's less likely here given the intensity of the tracer uptake and the fact that vertebral body involvement is more pronounced. To further assess this, an MRI would be the next logical step to evaluate the disc space and any associated abscess formation. Speaking of MRI, we've also got these sagittal and axial images here. There's a narrowed L2-L3 intervertebral disc space, and I can see a cleft of fluid signal, which suggests infection or decitis. There's also disc material protruding into the spinal canal, which means there's a risk of spinal cord compression. The L2 and L3 vertebrae show low T1 signal, which is classic for vertebral body involvement in decitis. What's also important is the avid enhancement following contrast, which strongly suggests an infective process. The axial T2 image shows high signal in the adjacent psoas muscle, likely due to a psoas abscess. This is a common complication in decitis, and we can see a focal collection here, particularly on the left. Given these findings, I'd definitely be concerned about nerve root involvement and possible cauda equina compression. In this case, the next steps would involve further evaluation of the MRI to confirm the extent of the abscess and nerve involvement. Consultation with a neurosurgical team is essential at this point due to the risk of spinal cord compression. Now, if you're looking for more radiology cases like this, don't forget to hit that subscribe button for Radiology Made Easy. Let's keep learning radiology the fun way, one case at a time. Stay tuned, and see you in the next case.